Authority. People like to follow experts in their industry. It's kind of common sense, but this is still based on biology, that consumers want to follow the lead. They want to follow the expert. So the question is, looking up on the screen now, are you guys the expert? When that consumer walks in, all the things that you see up there, from a staff, how the staff presents themselves, how they walk around, how they talk, look, act, speak, how you speak, everything that you see up there goes into whether or not a consumer looks at your orthodontic practice and goes, these people are the experts. How from the time they're talking on the phones, how your receptionist overcomes objections. Hey man, how much do you guys charge for braces? How much do you charge for Invisalign? How that's handled, the consumer is looking at you as an expert, or they're going to the next place down the street, or the one that they called prior to even calling you to begin with. So these are things, if you want to take notes on it before I flip the screen and go back and remind yourself, every one of these things need to be top notch, and again it goes from growing inside out. You need to be better at everything on there than your competition. If you do, you're going to win. Just that alone on that page represents 15% growth for your practice. Just that alone. No matter how good you think your practice is doing, that alone can grow your practice 15%. The more you can show that you're the expert, the more you convince the consumer that you're the expert, the more you're going to grow. Which is why we'll give away this quick tip. I don't know why, but for whatever reason, doctors in dentistry seem to be the only doctors that diagnose, but then turn around and only recommend treatment. I don't know why that is. You need to use the word prescribe. You're an authoritative figure. You're the expert. Don't recommend treatment. Tell them what to do. And don't give them options. They want to look to you as the expert. If you think Invisalign is going to treat the problem in their mouth, prescribe them Invisalign. If they want to object and ask questions after that, that's fine. If you don't think Invisalign's right for them, and you just think braces is going to fix the problem, prescribe braces. But by giving choices, you're actually confusing the consumer. They want to follow your lead. They want to follow an expert. So if you talk the right way and you prescribe what it is you believe is best for their condition, you're going to increase your treatment acceptance right away. Any questions on that?
What percent of your patients do you think that when they enter into your exam routine, they're neutral? They don't really have, they might be more familiar with braces, they might be semi-familiar with Invisalign, but they're actually neutral to the choices.
I think for us, at least, it depends on where the patient is coming from. If they were referred by a dentist, they're definitely not neutral. They want treatment, they're educated on it. If they came in from the internet,
right. When I say neutral, though, as I guess I'm saying like neutral to, is it braces, is it Invisalign, is it clear, is it, metal, neutral to the options that you might discuss during their exam.
mostly.
I think our people know what they want to.
Okay.
Yeah, telling us what they want, and then if we think it's a better fit, then.
I think if you just looked at the average consumer and said, here's all the options you have, do they want to hear what you suggest, or do they want to just make the decision? I think you'd find most of them still want to hear what you suggest. All right? They may have a preference based on a friendship, or their mom or dad's opinion, or a commercial, or whatever. But really, they're pretty neutral in terms of they really want to hear what you have to say about it, and that's going to lend itself to be a very convincing part of their decision-making process. Right now, after you make your prescription, as Brian's saying, so you prescribe to them, I really want you to do Invisalign. I think Invisalign's the best fit for you for these variety of reasons, whether that's activities or clinical treatment or whatever. They may definitively tell you, I'm not neutral. Right? They may very well come right out at that moment and say, I want purple rubber bands. I really had my heart set on braces so that I could have purple rubber bands. All right? You guys have run into that situation. Likewise, you might have said, you're a pretty complicated type of malocclusion. I really think we need to do this with braces. And mom or a kid looks at you and says, if we have to do braces, honestly, I don't know that we're going to do this because we really had our heart set on doing Invisalign, or at least we're not going to do it with you. Right? But making the prescribed recommendation will define very quickly, were they neutral or did they have their heart set on something else? But the fact that you prescribed empowered you as the authority within the practice and actually puts them into a better buying position for the consideration of who they're going to do business with. When you do an either-or approach, not only does it confuse them, what else does it do? It delays them. I mean, how often do we have a mom and their teenage son or daughter sit with them and they say, I gotta go home and talk to my husband. The either-or approach creates way more I gotta go talk to's than same-day starts, right? That is just the biology, the science of making a consumer buying decision.
Isn't that the job of the treatment coordinator though, is to kind of dig and see if they have a preference, and then us going in and, I mean, in most cases, I think you could do both braces and Invisalign, that's my take on it. And having a consumer who kind of pushes you to do Invisalign on cases that you didn't think you could do helps become a better provider. So I think it's good to have an open mind as an orthodontist and kind of go with what the consumer is looking
And
for.
I agree with you completely on that comment. And if the treatment coordinator does their job right, that is exactly how it should work, so that you can come in, the treatment coordinators come out, they've caught you out in the bay, and they've said, hey, this patient's really more excited by whatever that appliance is. So now you can come in and you can prescribe to their preference, right? Because if you can come in and say, wow, you know, you're so active in soccer and basketball, and man, you've got a busy life, and mom, sounds like you're busy as well. I'd really like to prescribe Invisalign because you're so active, and Invisalign's such a great appliance for kids that are in sports and moms that have busy schedules. When you can make a lifestyle prescription, you're going to be in a much different place than if you came in and even knowing that information and said, well, we could do either, and kind of rolled from there. It's a very different mindset of how the consumer's going to respond to that. So you're exactly right.
And that, from what we've seen, unfortunately, a lot of the treatment coordinators don't do, like, you're probably awesome at what you do. Most don't set up the doctor properly for that to then take place. But like, just like he said, if it does take place, then you're able to prescribe exactly what the consumer wants. My question is how far do you go? Because if the consumer says, I want treatment A, and you walk in there and you know treatment A is not going to be the right treatment for that patient, and these are things I don't know anything about. I'm just asking a question. How far are you willing to go to just give it to them, if that's what they want? We work with some doctors that will just do whatever the consumer wants, even though the treatment they know is not going to be great. But they just gave the consumer what they want. And that's just a question to think about.
I'll talk ethical plans into if they really want braces, and I feel like it's better with Invisalign, I'll explain that. But
Okay.
try to, at the end of the day.
Right.
Well, there might be whether it's a clinical decision you're making like you're describing right there, or sometimes it's a business decision. I mean, you might see business advantages that if I could take this moderate 12-year-old patient, moderate malocclusion, it's like I know Invisalign's going to get done pretty fast. It's a really easy treatment. They're going to enjoy it more. I'm going to have a whole lot less complaining. I'm not going to have any emergency appointments. I'll have less appointments. I know business-wise that if I could take this 12-year-old and say, do Invisalign, I'm going to be a happy doctor, and they're probably going to enjoy it as well, right? Unless they say I'm not neutral, right? So if you can kind of discover certain things about that 12-year-old that would lend towards being an Invisalign recommendation that's personal to their lifestyle, you've just accomplished your goal. So I kind of call that like the nirvana combination. You want it to be done with a certain appliance. They feel like that's the right appliance to do it with as well. You marry those two things together, you've got the nirvana experience that's going to take place. They're going to enjoy the experience more. They're going to be more passionate about their appointments when they come to see you. They're going to be more likely to refer you out, and you're going to get very positive business benefits that will come with that as well. And the same thing could happen if it were a braces combination, you know, for whatever that reason might be, right? So if you can kind of lead them in that TC exam room part of it to then allow the doctor to come in and prescribe towards it, you're getting the optimal result. Sometimes you end up suboptimal. The situation Brian just said, where you come in there and say, I really think we should do this with braces, and the patient says, I really want to do this with Invisalign, you got to throw your hands in the air, and you go, okay, we'll do it anyway. And it's not going to be as perfect of a symbiotic relationship, but you gonna get a good result. I mean, you're a good orthodontist. That's the whole point here, is you're gonna get a good result. You're just gonna lose maybe some of those advantages, either clinically or business-wise, that you were hoping for. So that's a lot of stuff that I do personally when I'm working with treatment coordinators, is helping them to build the process around that whole mindset of that nirvana combination.